Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, listener, and thank you for coming back to listen to the Wow MD podcast. This spring, 2025, the focus is on beauty. And in this episode specifically, I have a highly respected guest, someone who I hope to bring in again in the future, especially on the topics of beauty. So for today, I invited Meghan Morrissette, a dedicated aesthetic nurse and a master injector, to come and share her wisdom and share some pearls regarding filler injections. I bet you all want to know about that. But before I'm introducing her, I'm going to let her say hello and introduce herself.
Hello, my name is Meghan. I am an aesthetic nurse working in the aesthetic industry now for almost 15 years. I'm really excited to be here today with Dr. C to discuss the purpose and the modern day use of dermal fillers in aesthetics practice. We're going to talk about how they are used, who is a good candidate, and some of my favorite products that I love to inject. I specialize in facial balancing and contouring with injectables. However, I also use lasers and other procedures to restore beauty and treat the aging process. I'm really excited to join Dr. C today on the podcast and discuss the subject of dermal fillers that is extremely pertinent to our beauty and aesthetics industry. We're going to talk about how fillers can address moderate to severe lines and wrinkles and the sagging of the face that happens as we age. We'll talk about what is new in the field of injectable fillers and some of the products that you might have not heard of before. How are these products better? How do they compare to each other? I will also go over when we use fillers versus neurotoxin. I do have patients that come in and think that they can get Botox in an area where fillers should actually be injected and vice versa. So we'll answer some questions about that. I do work full-time as an aesthetic nurse for Hera Beauty and Wellness, and I work alongside Dr. C. I'm really excited to partner with Dr. C, and will likely come back on future podcasts to talk about other interesting topics, the trends of the beauty industry, what lasers work best, and what kind of outcomes you can expect, give you a little information about the cost of different procedures, and so much more. And I'm really excited to be here today.
Thank you, Meghan. Now, let me say a few words about Meghan. If you are one of my patients, you may already know who Meghan is. You might have even had a treatment with Meghan. However, for those who do not know who Meghan Morrissette is, before she's going to say a few words about herself and how she decided to become an aesthetic nurse, I want you to know who she is from my perspective. Well, as a doctor, I love to educate, and I have tried surrounding myself with people who share my passion for knowledge and educating others, hence my podcast and all the social media that I do. I firmly believe Meghan shares my passion for educating her clients and allowing them to make the best informed decision for their beauty. Also, Meghan is a dedicated professional, as I like to say, head to toe and inside and out. Maybe too much professional sometimes. We really need to make her laugh more. Meghan takes her mission to help others achieve their beauty goals very, very seriously. And her main goal when formulating a treatment plan for a patient is about enhancing their beauty and letting it shine through, rather than achieving a look that they're looking for, but it really doesn't serve them. So both Meghan and I share the same values as far as ethics and professionalism. And what I mean by that is the fact that we put patient results, patient satisfaction, and patient beauty above and beyond profit. We care about what's right, We care about making it right. And above all else, both Meghan and I will be honest about what we believe will help someone achieve their goal using either lasers, injectables, skincare, PRP, exosomes, or a combination of all of the above. Now, I would like to say a few words because this is a podcast episode about fillers, therefore injectables. I would like to say a few words about when I first introduced injectables to my practice. Now, that was in 2021 when I hired a family nurse practitioner who was already an injector. Then Meghan came my way in 2022, and to be honest with you, until she came along, I didn't think that there was a big difference between injectors. You as a patient or client probably do not believe that there's a big difference between injectors. Maybe you are purely price and cost driven. Well, I thought they were all about the same, with the same skill, doing about the same thing and going about their business of injecting people. However, just like doctors are extremely unique in their personality, in their skill set, in how they use their logic, their judgment to gather and process data and reach a conclusion, establishing a treatment protocol, so are the injectors. Today's beauty industry is a very desirable field to be in. Many young women, mostly women, aspire to become nurses and specifically nurse injectors. But becoming a master injector is not easy. It is a road paved with sacrifice. It requires time and money and willingness to go above and beyond to learn and master new skills. And, in my opinion, it requires an inclination for art and an eye for the inner beauty and the existing potential of each individual client to ultimately achieve outstanding results. Results that the client and everyone else around them will be pleased by. So, Meghan, what is your opinion about becoming a master injector? Can you tell us a little bit about your journey?
Yes, you are absolutely right. Most practicing aesthetic injectors, they will recommend whatever they have available in their office. They will market what they have at their disposal and will say that it's the best thing. At our practice, we have an array of cutting-edge technologies and products to choose from, and we love combining these technologies and treatments that complement and work together to achieve outstanding and long-lasting results for our patients. It takes not only skill, but a vast amount of knowledge regarding facial and body anatomy, as well as experience and exposure to the skill of others. That means exposure to the mistakes of others as well, therefore learning what not to do and how to correct those mistakes when necessary. But most importantly, you need an artistic eye to see beauty in general and to see where the opportunity is to enhance someone's features. An artistic injector has the ability to place filler in a way that is undetectable, so that when you leave the chair, the work that was done is not obvious in any way, shape, or form. You simply look better.
I agree. That's excellent said. An artist is someone who will apply their skill in injecting. So at the end of your treatment session, you look in the mirror and you suddenly see the person you were searching for, the younger you. Unfortunately, today's world and today's internet is filled with women and people that have been treated for the sake of the treatment and the revenue. Most of the time, people that have been treated to achieve an unrealistic goal that looks good on someone else, but does not fit them. Again, not everyone will look like Angelina Jolie. You see plenty of women who have been treated not for the sake of their beauty, or women and men who have been excessively treated, either in the hopes of better revenue, as more material means more profit, or with the hope that if you give someone exactly what they ask for, even if you know it is not a good fit for them, they will be pleased and happy. Well, I've always had a holistic view of beauty in the sense that we should do as much as possible naturally with as minimal visible impact as possible, but also do something that creates results, that slows down or corrects detrimental changes to our face and our body that happen with age and obviously various medical conditions. And then the truth is about fillers that filler injectables and the art of injecting fillers can achieve something that no skincare creams in the world and no laser in the world as of today will achieve for women and men. Well, we can do a whole podcast episode about this and how people are overfilled and what the beauty goals are, but let's the two of us stay focused on fillers. So, Meghan, how do fillers play a role in facial aging and anatomy?
Yeah. So I hear clients, they come in all the time and they say to me, I suddenly look older. When I look in the mirror, I don't recognize the person that I see. And to many of them, this can seem to come out of nowhere. Typically, we do maintain much of our youthful volume in our face and our skin integrity well into our mid-30s. It's also around this time that many of us start to notice subtle changes in volume. More apparent nasolabial folds, for example, the downturn of the oral commissure, and for some, even the start of a jowl formation. For some, this can happen sooner than it can for others, but altogether, the aging process is inevitable.
So what I hear you say when you describe all these changes in the face, with the nasolabial folds, those are the smile lines, right? They get deeper and deeper. The downturn of the oral commissure, you mean that our mouth turns down and we start looking very sad. And jowling is pretty much when the lower face, unfortunately, just starts hanging down. It's not a pleasant look. And you, as a woman, if you look in the mirror and you've seen it on your face, it bothers you if it's a minute amount. I know it started bothering me when I turned 55 and I noticed it. And trust me, I am fighting that really hard with all kinds of technology and things. Again, when it gets beyond the point and you lose the volume, the only thing that helps with that is actually fillers. But when it's early, you can probably use skin tightening and lasers for that. But more to come in the future.
Yeah, so going back to the aging process, I also believe that this process is multifactorial. What I mean by that is that we are not only aging in our skin, we're also aging in our deep fat pads. We're aging in our more superficial fat pads. We're aging in our bones. Specifically, our mandible and our maxilla bones are changing as we get older. Understanding the process of aging from every level, skin to bone, is what enables clients to have a better knowledge of not only what is happening to them, but what they can do to slow down this process and turn the clock back. Of course, the methodical use of medical-grade skincare, consistent neurotoxin treatments, and collagen-stimulating procedures and lasers are really important. We also still have to replace the lost volume in the face. This is done primarily through the use of dermal fillers, but also biostimulatory injectables such as Radius and Sculptra, and in some cases, your own fat, are the perfect solution for this. I think it can be confusing to patients sometimes when they look in the mirror to determine exactly what they're seeing in front of them. Scheduling an assessment with a provider such as myself will allow clients to better understand what they can do to improve this process, to slow it down, and how lasers and fillers can treat these different issues. With a curated treatment plan, I am able to improve skin texture, pigmentation, skin clarity, while simultaneously addressing the face shape, proportion, and balance with the right choice of dermal fillers.
You jumped ahead a little bit because actually my next question was, when does someone know that they need a filler treatment? When does someone know that they need, or how do they know that they need to have something done, or what's the best solution for their specific aging process? And you went ahead and described very clearly that someone will need a consultation. So they would sit down with someone that's very experienced at multiple procedures and technologies. Usually, like you said, it's a master injector. It could be, even though I'm not a master injector because I do not inject, but I know enough about the process, I can recommend, hey, this is be fixed by Botox. This is going to be fixed by filler. This is going to be fixed by laser. I have some patients sometimes who point out blank, come and say, I don't need a laser. I don't need a filler. I don't need a Botox. I don't do any of these. So sometimes there's limited amounts of what we can help patients. But like you said, it's great. And this is the first step. You want to sit down and have a consultation with someone that understands and practices all of these technologies. They can give you a treatment plan, and then you can choose whatever fits your beliefs and whatever fits your pocket, obviously, right? So first we start with a consultation, correct?
Yes, definitely a consultation is completely necessary to do an assessment, have a conversation about what are the things that bother the patient. And then, of course, sometimes I see different things that the patient sees. They think that their chin is doing something different and really it's something else. So a consultation is helpful because it allows the patient and the provider to kind of come together and be on the same page and develop a treatment plan that's going to work for everyone.
Exactly. So just to sum it up, so we can stay on the topic of the fillers, the hyaluronic acid fillers are meant to replace lost volume in the face or on the body. Now, the loss of volume in the face happens because we age or because we lose a significant amount of weight in a very short time. Once we lose volume, we will have the skin folds in places where we didn't have them before. Or where before there were only mild wrinkles, now they're deep, severe wrinkles. These deep wrinkles can be filled with filler. Adding volume to areas of little volume, like our lips, is also a very desirable beauty goal. We know, and everybody knows, that lips can be shaped with filler. Restoring volume to the lower face to treat severe jowling is another reason for using filler. And last but not least, as we age, our hands lose volume and all we have is skin and bones. And you can easily tell by someone's hands their age. Therefore, many women now seek hand rejuvenation treatments, and using fillers, it's an excellent way to restore youth to our hands. So to sum it up, fillers can obviously smooth out moderate to severe wrinkles. We use neurotoxin for the mild wrinkles, right? They can also reshape your jawline. And you might say, well, these are things that maybe a facelift can do. Maybe that's true, but not to the extent that fillers do. Think about this. If you lose fat to the lower face and now your lower face has sunken in, all you have available is surgery, well, that will simply pull your skin up over your bones to stretch it. Would that look good? Would that give you back your youthful, plump look? Not really. It will make the loss of volume more apparent because it simply stretches the skin over bones with no underlying tissue to give it the plump and young appearance of a beautiful face. Maybe if there's some fat transfer done at the same time, you could get that result. But think about the downtime. Think about the risk of something not going well, not going the way you want it, or the way the doctor hopes to go. Think about the scar. Think about the scar on your body where the fat has been harvested from if you're getting a fat transfer. So it's no wonder that a woman facing the option of restoring her beauty with surgery, facing those odds, would rather use a filler instead. It takes months to recover from a major surgery as it involves a major facelift. It takes a long time for the bruising, the swelling to subside, for the scars to heal after a major facelift. Might be a little different with the mini facelifts. I am not a specialist, but Meghan can tell you more about it because she worked with her father, who's a facial surgeon. That's all he does. But the point I wanted to make is it takes 1 week for you to see results after a filler injection, to see your skin glow, to feel and look more beautiful and younger without any downtime, without any scars, and without any pain whatsoever. Am I right, Meghan? What's your opinion?
Yes, the amazing part about dermal fillers is that it provides you with an instant result. So I inject filler in a certain area of the face on someone and I hand them the mirror. They look and they're like, wow, oh my gosh, they see the difference right away. Now, that's not to be said that fillers don't have any downtime at all. Of course, you can bruise from filler. You can swell from filler. These are really common outcomes after being injected. Usually this is fairly minimal. I would say a few days of light bruising, a little bit of swelling for the filler to kind of settle in your skin and integrate with your own tissue. So to give you an example, most people can have a filler appointment, let's say at the end of their day, and go to work the next day without any sign that they've had anything done. If you have a bruise or if you have a little bit of swelling, I do give patients specific instructions, topical arnica use, oral arnica use, icing the first 24 hours, things like that to kind of minimize the consequences of the injections.
Well, nothing is that perfect. and without a few possible consequences or side effects or risks. So talking about risks, Meghan, can you please talk to our audience about the possible side effects of a filler injection? Are there any downsides to using fillers, risks, or complications? I know we build it up as, hey, it's much better than having your face lifted. It's the only answer to losing volume. But what are the downsides? And that's why I got Meghan here so she can tell you all about it.
Yes. So, of course, with any elective aesthetic procedure, there are always risks involved. During my initial assessment and consultation process with a patient, I'm careful to explain the potential downsides and risks of a treatment such as dermal fillers. First and foremost, the risk of vascular occlusion is possible. Vascular occlusion is when the filler that's injected gets into an artery and can possibly cut off blood supply in a certain area of the face. There are many cases where this has happened, and it takes an expert, skilled injector to be able to recognize when filler has been injected into an artery and is possibly occluding the blood supply. While vascular occlusions are highly uncommon, they do still occur. And having someone who is trained in facial anatomy and recognizing adverse events is really important in these cases. Other more common downsides that I feel I see more often is the overuse of fillers, which we did kind of touch upon a little bit already. We see patients walking around all the time now who look puffy, and the term pillow face or moon face comes to mind. Patients who are overfilled have had too much HA fillers injected in a given time frame, typically, or they've had too much filler injected into a specific area. Patients who look overfilled oftentimes may be seeing a provider who continues to fill them rather than saying no. I find that saying no to patients is so important, especially in aesthetics, because if you don't learn how to say no, you're going to end up saying yes all the time and giving someone a look that is not desirable. So unfortunately, overfilling continues to be an issue in this space, and the provider is typically always the culprit. In my personal experience, saying no is really important, and it shows honesty and integrity. Most patients appreciate honesty, and they are ultimately looking for expertise and guidance when it comes to deciding on facial fillers.
Thank you, Meghan. That was very enlightening. And just to touch on the vascular occlusion, that's a very serious event. When this hyaluronic acid gets injected into a blood vessel, it will obliterate the blood vessel, cut off the blood flow to that specific area, which will lead to necrosis. So if you Google vascular occlusion after a filler and click on images, all kinds of weird stuff will pop up. Now, those are rare. And usually, like Meghan said, if the injector is skilled, understands the anatomy, and sees an immediate blanching that happens when that is done, the key issue is to inject something that will dissolve the filler right away and to have that on hand, not to panic, and then to observe the patient, abort the filler injection, do it at another time. And perhaps now that we know that the anatomy is this way and you have this weird blood vessel where we didn't expect it to be, and then it's all good. However, that's why it's important for someone to understand when the mistake is being made on how to correct it. So thank you for that. And then the overfilling, hey, I don't need to say more. You see this all the time. People overfill their lips. They overfill their cheeks specifically. So they look strange. And anyway, that is the art of a true injector, how to make someone look better, prettier, youthful, and be pleased when they pick up the mirror and take a look, but not overfill them. So we kind of jumped ahead and described when a woman or a man might require a filler, but can we take a few minutes and discuss what is this hyaluronic acid filler? Why do we need it? And why the concept of fillers in the beauty industry? Clearly, surgery is not for everyone, and many men and women need something surgery and lasers cannot provide. So why fillers, and what are fillers?
Yeah, so a lot of people know what hyaluronic acid is. Hyaluronic acid is a substance that retains moisture. It's found all over our body, like places, our skin, our eyes, even the synovial fluids of our joints. As we age, the production of key substances in the skin like hyaluronic acid, collagen, and elastin, they all decrease. As a result, our skin loses volume, it loses hydration, it loses plumpness. Hyaluronic acid is used in the beauty industry and is very common in topical cosmeceutical products as well.
Okay, so we know hyaluronic acid is very important. It's a key substance in our skin, in our joints. It helps our skin look better, look younger, look hydrated, look lubricated, look plump. So I take it these companies, these beauty companies, decided to inject hyaluronic acid, make it injectable. So the hyaluronic acid is a synthetic hyaluronic acid product in a gel form.
Yes, that is correct.
Okay, so now can you explain the difference between a dermal filler and a neurotoxin before we get back to the dermal fillers? Because a lot of times, like you said, people are confused about, hey, I'm coming in to get my face injected and I need some Botox. And then they point to the nasolabial ridges and say, can you make these deep ridges go away? I'm like, yeah, but that's going to take filler. And then people say, well, what's that? So if you can explain, we know what dermal fillers are. We've talked about dermal fillers ad nauseum, but explain what neurotoxin is and how is it different than the filler, please.
Sure. So neurotoxin, it's a product that we inject into muscle and it temporarily relaxes muscle. So for 3 or 4 months, your muscle in your forehead, I'll use that as an example, will be relaxed and it won't be moving, creating those lines and wrinkles that you get in the forehead. That's what Botox will give you. When you have a fold or you have an area where you have volume loss, Botox is not the product of choice. It's not a muscle problem. It's volume loss to your skin. And so that's where we would inject filler. So there is a big difference between the two. So Botox, once again, it's going to temporarily relax your muscle. It's going to smooth some fine lines. It's going to make you look more awake, maybe more refreshed. Filler is going to replace lost volume. In areas that we typically see lost volume is the nasolabial folds around the mouth, the upper lip, under the eyes, the chin, the marionette area, and the jawline, even the hands. We lose volume in the hands, which we did touch upon earlier. So filler replaces volume. And the concept of replacing volume has actually been around for many, many years. It started with fat, and then bovine collagen came out in the 1980s, and that was popular for a while. The introduction of hyaluronic acid fillers actually gained popularity and traction in the early 2000s and has since become a huge and important part of the aesthetics industry, mainly because hyaluronic acid fillers are very safe. They're hyaluronic acid gel. They can be reversed if needed. They're not permanent. So hyaluronic acid fillers, of course, are made from a synthetic hyaluronic acid gel, and they are a gel-like substance that can subtly restore volume loss in skin.
So as a conclusion, the hyaluronic acid fillers are extremely safe because they mimic a naturally existent substance in the skin. And this substance is indeed synthetically produced, and it's in a gel-like substance, but it's injected, and because the body already has it, remember the bioidentical hormones that I talk about all the time? Well, hyaluronic acid, it's a bioidentical product. It's the same as your own hyaluronic acid, so the body receives it, embraces it, accepts it, and more so, it acts like a sponge, like a matrix that actually attracts some of the water in the tissues around it. And it will actually plump up even more after the injection. So it's not just the filling effect, but actually there's a post effect of actually plumping that's on top of whatever is being injected. So anyway, you can restore volume loss in the skin of the face. And now people do a lot of things with their buttocks and other areas with filler. Whether that's the new trend that maybe one day we'll inject it in the breast too, I don't know. But fillers are here to stay. They are actually excellent for certain things. And sometimes you look at a patient and you look at a woman that wants certain things changed to her appearance and you're like, yeah, only fillers are going to give you that. Okay. So do you want to give us a little bit of an example about what's the modern day facial fillers? Give us some names of products that you like to use.
Yeah, so there's a lot of products now on the market. A lot of companies offer dermal fillers. And so some of the common terms that you may know, Juvederm has been around for a long time, and Restylane, those are very popular hyaluronic acid fillers. Some other names and some other products that I like are Voluma and the whole RHA line, which is a newer line of fillers. They're still hyaluronic acid. They're still in that gel form. However, they have a little bit better stretch. They don't swell as much, and they integrate with the skin just a little bit more naturally than some of the other older products like Juvederm do. There is another class of fillers that we consider biostimulatory fillers. And these names are Sculptra and Radius, which you may have heard of before. And we use them in a little bit of a different fashion. They're injected a little bit more superficially in the dermis, and they actually stimulate new collagen, whereas the hyaluronic acid fillers that we inject do not stimulate collagen. So biostimulatory products like Sculptra and Radius are very popular. They do great in combination with laser treatments, and I think they're only going to become more popular as time goes on.
Oh, that's great. So I honestly don't know much about these biostimulatory fillers. Clearly, this is a more modern trend. That's very interesting to know. What other uses are for the biostimulatory fillers? Now that you mentioned them, let's tell the audience what are the things you can do with these fillers other than just treat the face?
Yes. So I use biostimulatory fillers in other areas like the hands. If I'm filling someone's hands, I typically will use Radius, which is a thinner product that's going to give the hand a little bit of volume, but it's also going to stimulate new collagen. And biostimulatory fillers are also used on the body. So, for example, the tops of the knees where you start to lose volume and get crepey skin. Radius and Sculptra are great on those areas as well. We also use them in the butt if the patient either is electing to not have fat transfer to that area, or if they are not a good candidate for fat transfer for whatever reason. Hyperdiluted Radius or Sculptra are also common products to use in the body area, like for buttock enhancement. So there's a lot of applications for these products. However, they also come with some restrictions for patients. So I don't just pick up a syringe of Radius and inject that on anyone. Patient selection is critical when it comes to biostimulatory fillers. And this is mainly due to, if the patient has a history of an autoimmune condition like lupus, MS, Crohn's disease, things like that, that might not be the best candidate for biostimulatory products because the outcomes can be unpredictable. They might develop nodules. They might react to Radius or Sculptra because they're not simple hyaluronic acid gels. And so you want to make sure that you really scan your patients and have a good assessment initially before choosing which product to put in them. And if they have a history of any of those autoimmune conditions, I would probably not choose a biostimulatory filler. Another interesting use of biostimulatory fillers is for scar treatment, and specifically the treatment of acne scars. So Sculptra and Radius do really well in scar areas because, like I mentioned before, they stimulate new collagen cells, and so it can help improve the look of that sunken in scar.
Well, thank you, Meghan. That was very enlightening. And that brings to light the importance of actually talking to your patient and not just, oh, yeah, you want your face looking prettier? Great. Well, what are your medical conditions? Is there anything going on that I need to know about? So I love that Meghan mentioned that because it just shows the difference between somebody who's just injecting and somebody who actually cares about the outcome of the injection. So you want, again, a master injector, someone with experience that's going to consider all these factors. And Meghan insists at our practice that we do what's called a medical clearance for all the new patients, especially in certain situations, and maybe not so much for lasers, but definitely for some injectables. So I'm glad she brought that up. So one more thing before we go, when does someone actually need a filler in your experience? Is there a question of age? Is there a question of looks? What can you tell us about that?
Yeah, that's a great question, and it comes up a lot in our everyday practice. So, in my opinion, anyone really who is over the age of 21 that is showing signs of volume loss can get a filler. Or if they're over the age of 21 and they have genetically really, really thin lips and they want to enhance their lips, or they have a chin that is not fully forward, if their chin is a little bit off balance, they don't have a strong chin or jawline, and they're still younger, we can use fillers on those types of patients to balance them. So I don't think there's a specific age number that I go off of. I typically don't inject fillers on patients that are younger than the age of 20, 21. But there has been an influx of younger clients who come in and they are seeking lip enhancement, or they're seeking chin enhancement or jawline balancing. And that's a really common thing I see now, much more than I used to see. So patients will ask, when should I get filler done? Or do I need filler yet, do you think? And my answer to this question is usually pretty open-ended. And I will assess where I see volume loss or where there's an opportunity to improve something that has changed. So I do inject patients who are younger than 30 often, and I inject patients who are between the age of 30 and 70 very often. So there's really not a number. It's really more based on assessment. There are also certain patients who have really naturally round, full faces that may not lose volume like other patients, or they might not need volume replacement, but rather the injection of fillers can actually play a role in helping to slim their face and elongate their chin and other things. So you can still improve their look even though they haven't lost volume. So in summary, there's really not a specific time frame that you have to get fillers or that you should get fillers. Different people age differently at different rates. And so with the current medical weight loss epidemic that we are all a part of, and a lot of patients that we see are on GLP-1s and they're losing weight at a pretty fast rate, volume replacement with fillers has grown, and it's only going to continue to grow exponentially.
Well, thank you for mentioning that. That should be a topic in as of itself, as far as the GLP-1s and the consequences and the changes to a woman's and a man's body when they lose fat and muscle on top of all this. We do like to lose fat on our bodies, but losing fat on our face will definitely have a long-term impact that most people will have to come to terms. Maybe not immediately when they lose the weight, but definitely 5 or 10 years down the road, if they lose their weight in their 40s and 50s, there will be a reckoning, because now they'll realize, what have I done? What is going on with my face? And now I need to do something about it. So that was awesome information. Thank you for sharing all this knowledge and all these facts about fillers. And last but not least, do you want to say a few words about Skin Vive? Now, as far as I know, this is a droplet hyaluronic acid product launched on the beauty market by Allergan, and it's made by Juvederm. And then we talked about volume, talked about the facelift. We did not talk about the skin quality. Neither the filler injectable nor the facelift will address the skin quality. So if you want to say a few words about that.
Yeah, I'm glad you brought that up. So you are correct. When patients get these deep plane facelifts and things like that, it doesn't change the quality of their skin. So what I mean by that is if they have pigmentation all over their skin and they have lots of fine lines and wrinkles, just pulling that skin up and excising some skin, they might look a little bit younger, sure. They might not look as saggy, but it's not going to improve their skin quality. And if they have had a lot of sun damage and other things like that, it's not going to change that. Even with the HA fillers, going back to them, plumping up the skin isn't necessarily going to change their skin quality. So typically that's done with lasers. And also going back to the Skin Vive, the Skin Vive is not really a filler. It's more like a hydration treatment. It's newer on the market. It's injectable hyaluronic acid, but the viscosity of the product is much thinner. So we do little microdroplet injections superficially into the skin just to hydrate the skin, plump up the pores. It's not going to change the structure of the face. It's not going to make someone puffy, give them bigger cheeks, change their chin, anything like that. It's just a hydration treatment. And it's another tool in our tool belt that we have to improve the hydration of the skin, and we can use Skin Vive in conjunction with laser treatments. And at least in my experience, using it in combination with laser is the best way to treat Skin Vive in aesthetics.
Oh, great. So as a recap, when we age, our skin becomes drier, thinner, and loses its glow. So as a reminder, hyaluronic acid is the water attracting molecule that's found in your skin, will always decrease with age and will decrease with sun exposure. So these little micro droplets of hyaluronic acid are available in a series of mini injections distributed over the desired area of treatment. Specifically, it's the mid-face. It will hydrate your skin from within. So these droplets of hyaluronic acid will address and improve the dullness and the texture changes that happen as the result of aging or the sun exposure. So in your experience, how effective is SkinVive and how happy are your clients after the procedure and how much does it cost? Obviously, this is a little bit more finite cost because it comes in a set with 2 syringes as opposed to the filler cost, which is highly variable because it depends on how much material will take to achieve the results. So do you want to say a few words about that?
Yeah, so I think that when patients come in to get a SkinVive treatment, they're really happy with the results. It's subtle. Their skin looks a little bit more glowy in a couple weeks. They look a little bit brighter. Their skin has better hydration. I personally like SkinVive in combination with a laser treatment. So doing a laser and injecting SkinVive, getting it into the skin right after, I think is the best way to use it. But yeah, I mean, it's a nice treatment. It's not going to necessarily fill lines and folds like we've been talking about, but it's a good thing to add on to a treatment. And the cost is somewhat minimal. I mean, you get 2 syringes in a box that we get to use, and we charge the same amount for SkinVive that we would charge for 1 syringe of Restylane, let's say. So the cost is minimal and it's really affordable, and anyone's a candidate for SkinVive. Literally anyone who has skin, we all have skin, you can have a SkinVive treatment, which is really cool.
All right. And if you want to see me getting my SkinVive treatment, go ahead and head on to my social media. I think we posted that on Instagram. We did that last year, didn't we? Yeah, in 2024. So thank you, Meghan. It was great having you on the podcast. I'm excited and looking forward to sharing this platform of education, not just for our clientele who might have questions and hopefully we'll direct them to the podcast now, but also for whomever might come upon the podcast episode and want to know more about fillers. Thank you for listening. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.